So 4 new cases overnight, and our contact tracers have been doing their work, and all of the people they've been working with, thank you very much, because all of these were known contacts. So we had one in hotel quarantine, a returned traveller from the UK. So there's that case, our usual case in hotel quarantine of an overseas returned traveller. Then 3 community cases. One is the brother of that case, of the receptionist at the Prince Charles Hospital. So they became infectious on the 26th of June. They were up in Magnetic Island. They then returned down to Brisbane, and they did attend a school holiday tennis camp, the Shaw Park Tennis Centre at Wooloowin, on the 28th of June. So we'll be contact tracing there. But we'll just work through what those risks are from that particular individual. Then we also have a co-flight crew member of that Virgin crew member who was on those 5 flights while infectious. So they were in quarantine, and we're just working through whether they were out and about before they went in quarantine during their infectious period. So we'll be looking at that. And then we had another case related to that Portuguese restaurant cluster, and they were, because they were a close contact, they were in hotel quarantine during their entirety of their infectious period. So that's not a concern. So we now have those 42 active cases, which does concern me because a lot of these active cases are the Delta variant, and we know that is very contagious. So yes, we are doing our best to manage that within our hotels, but they're not designed for that process, and we're also doing our best to manage them in our hospitals, but it is a very, very contagious variant. Thank you to every single person who's come forward over the last 24 hours to get tested. We did 18,447 tests on 18,183 people, which is a magnificent response, particularly those people up in Townsville. You really came out and got tested. Thank you very much. Now, I have some good news about Townsville. I was concerned about that ferry terminal because of the linkages between Palm Island and Magnetic Island. You need to go through that same ferry terminal. But the family from Brisbane who went up to Magnetic Island went in a car, and they were in a car when they went across to Magnetic Island. They didn't go out and about into that terminal, which significantly reduces the risk for those people from Palm Island. Doesn't remove it, because we know that the people from Palm Island frequently come into Townsville, and they may have gone to one of the venues in Townsville, such as that those markets on that Sunday morning. So it doesn't lift the need for the restrictions. It's really important that all those people in Townsville City, Magnetic Island and Palm Island remain in their homes or residences for that 3-day period, except for the 4 reasons you can leave. But it has, I thought it might be reassuring for those people in Palm Island, because I know they were quite concerned about the terminal. So we've done a record day in terms of vaccinating, and we are going to be using every dose of Pfizer vaccine that we get from the Commonwealth. Of course we are. So please, if you're in those groups, particularly if you're aged care or disability care worker or a healthcare worker, you are an absolute priority. You must come forward and get vaccinated. That is really, really important. You are a priority. Then anyone aged 40 through to 59, if they can get a booking, we really want people to focus on bookings rather than walk-ins, because if you walk in, there's a good chance you won't be able to get vaccinated, because we'll always do those people who've booked first. So 40 to 59-year-olds, go online and find a booking, and all of course, are 1A, 1B, so that you get vaccinated in one of the Queensland Health Pfizer clinics. Now, the Commonwealth has said they will start distributing, when they get some more vaccine, Pfizer to GPs, so you'll be able to go to some GPs who get allocated that Pfizer vaccine. Now, anyone who is aged 60 years or older, please, if you haven't already, immediately make a booking. There is plenty of AstraZeneca vaccine available. Make a booking to go to your own GP. If your GP is providing vaccine, go to one of the pharmacies, and there are more pharmacies being stood up, or go to one of the Commonwealth vaccine centres and get vaccine there. Some of our hospital and health services will also have AstraZeneca vaccine. Now, if you have already had one dose of a vaccine, it is vital you get a second dose of the same vaccine. It doesn't matter what your age is, you need to get a second dose of the same one. Thank you.